I met Maria on a freezing cold day in December of 2021. Picture this. I was dressed in long johns and ski pants, a jacket, hat, and gloves, and I was still cold. Maria was dressed in little tight skinny jeans, a crop top, and a jean jacket. She was shifting back and forth trying to keep up her body heat as she held her dog close to her body. She and her father were speaking softly in Spanish to each other. They'd been waiting a really long time to be seen at our free veterinary outreach clinic where I worked. I approached them. Hola, mi nombre es Hannah. ¿En qué puedo servirles? Hi, I said. My name's Hannah. How can I help you today? Maria answered in Spanish. My dog Luna has been coughing and coughing. We're afraid she has COVID. She glanced at her father, hesitating. My dad is really sick too, but he won't go to the doctor. He's afraid of ICE, of immigration. But I'm afraid he'll die. I don't want to be alone. Maria's words stopped me in my tracks. No child should have to live with this kind of fear. Motioning to some chairs I had set up nearby, I asked if we could talk. I began my exam on Luna, weaving in questions about their pet's health along with questions about their living situation. Maria told me that she had been living with her grandmother, who had died of COVID. She had to move in with her father, who was living in his car. He had lost his job at the beginning of the pandemic and been living homeless ever since. I asked if Miguel had been tested for COVID, and he said no. Next, I asked if they had had their COVID vaccines, and they both said no again. I wondered if it would be okay for them to talk to her social worker while I finished up with Luna, gave her vaccines, and took care of her. This time, they said yes. We vaccinated Luna against rabies, so if they could get housing, they could get into housing, dewormed her, treated her against fleas, and gave her a little cough suppressant. Turned out that she had kennel cough, not COVID. She was all finished, so we packed our stuff up and walked over to the King County medical van, which was parked right behind our veterinary truck, because we know that co-locating providers improves access to care. Maria agreed to help her father and translate, and he said yes, he would have an exam and get tested for COVID. Miguel was negative for COVID. The look on his daughter's face when she heard the news almost made me cry. She was so relieved. Miguel received antibiotics for bronchitis. Maria and Miguel got their COVID vaccines, and our social worker was able to get them into housing that night. That night. So how does this happen? How does a man who's been hiding in the shadows, afraid to come out to see a physician, end up accepting both medical care and housing? It all has to do with trust. Maria and Miguel's love for their pet brought them into the clinic. And then the trust that was built as we cared for Luna paved the way for them to accept medical care from providers co-located with our truck, with our clinic. Maria and Miguel's story is not unique. It's just a particularly good example of how people's love for their pets can serve as a doorway to health equity. My name is Hannah Ekstrom. I am the founder of Seattle Veterinary Outreach and part of a wonderful Robert Wood Johnson Clinical Scholar team composed of Dr. Kathleen Wheeler, a physician, and Jessica Lowry, a nurse, all working together with me to help improve health equity for people like Maria and Miguel. Our team was interested in looking at ways that we could use the power of the human-animal bond to be able to build trust with disenfranchised individuals. We knew that veterinarians are among the most trusted medical providers. In fact, a study by April Kedrowitz and Kenneth Royal in 2020 showed that, in general, people in the United States feel that veterinarians are more trustworthy, more sympathetic, and less arrogant than physicians. Now, there's a lot of physicians in this room, so I'm not saying that's true. But what I am saying is that over the past 31 years, I myself have noted how quickly people trust me, open up their lives, and share all sorts of details. And so I really believed that this idea could work. And the team that we put together brought so much expertise into making this happen. One thing that's really interesting is that the trust that people have in veterinarians doesn't just extend to their pets' care. It actually also extends to decisions they may make about their own medical care. For example, people who came to the veterinary clinics were more likely to get vaccinated against COVID after they saw the veterinarian than when asked before they saw the veterinarian. They said that they trusted the information that they got from me in terms of vaccine efficacy and safety over that from the CDC or King County Public Health. Okay, I know that seems strange, right? I'm a practicing veterinarian, not a virologist. But I think it has to do with the personal touch that I can bring when I'm sitting down with them, right across from them. And I say, but you just vaccinated your pet. Why not yourself? Or, what would happen if you got sick and had to go to the hospital? What would happen to your pet? For the really tough holdouts, I can even talk about my own pets and how I feel about them and about never wanting to leave them. And it's a rare bird that turns down a vaccination when they think about the fact that they may not be able to be with their pet. So, over the years, our cross-disciplinary team put this idea into action. And this all brings us back to our big idea talk and our theory of change, which is that people's love for their pets can serve as a doorway to health equity. Does it work? Yes, it works. Over the course of the project's 2.5 years, our team provided over 5,500 veterinary exams and vaccines, over 1,500 medical care and harm reduction encounters, and over 7,500 social service referrals. That's a lot of referrals to needed services: health, housing, medical insurance, IDs, medication-assisted therapy. In fact, over 97% of people presenting for veterinary care wanted at least one social service referral, and some wanted as many as 8. Working across disciplines, across professional silos, doctors and dentists and veterinarians and social workers, vaccine teams are able to improve access to and acceptance of healthcare for people that don't trust in traditional providers. There are many reasons they may not trust in traditional providers and many barriers to care. But by co-locating and collaborating, we can improve health equity. And that's really important. People like Maria and Miguel are important. If you work in public health, let's say it's a vaccine team or medical street outreach or disease awareness or health resource fairs, consider including a veterinarian as part of your team, because it will improve health equity for people like Maria and Miguel. Everybody deserves a chance to be healthy. Thank you.